So looking at the anatomy of the eye, we can see that in this area, right, this is your eye. This is light comes in through here, through the pupil. This is your iris. This is the part that gives you that beautiful color. And then your lens is located directly behind it. And it changes shape based on the ciliary bodies, which are basically little muscles. And so as your eye adjusts to light and to be able to focus better, the ciliary body changes the shape of the lens for that purpose. So it is for the purpose of accommodating the lens to the image that it's looking at. Okay, so ciliary body, tiny muscle in your eye for accommodation. Okay, so this is different than the muscles that actually move your eye left to right or up and down. Okay, different muscle. And then so the image comes through the lens and reflects on the back of the eye on the retina. And in the retina are two different types of cells. You have rod cells, which see black and white images, so they see very just dark light contrast. And then those are located in the peripheral of the retina, and so they are for peripheral visions. They see the outer sides of the vision, and whereas the cone cells, and notice it's CCC, cones, color, central. The cone cells are located in the central part. They see what's central, so what's right in front of you, central vision. And then they also are responsible for color vision. Okay, so they're reacting here to the image that's reflected on the retina. And then those cells signal, send messages to the brain through the optic nerve, right? And so then you'll notice that from there, the optic nerve splits in half from each eye. So part of it goes to the same side of the brain, and part of it goes to the opposite side of the brain. And then so those are responding to the visual field that's reflecting on their side of the retina. Okay? And so that's important because now both sides of our brain are communicating. So what we see in one eye is being accommodated for with what we saw in the other eye. So we're interpreting the visual input from both sources to decide what we actually see. So development of the eye actually is really quick. So the eye itself, the anatomy of the eye is fully formed before birth. So as they come out, the eye looks exactly like it should for the rest of their life. So there's nothing that is added to. It's almost mature in size by 3 years of age. So that's probably another reason why your baby's heads are so big, because you have to fit your full adult height in there. And then the retina is really mostly rod cells at birth. So rod cells, remember, are peripheral vision and black and white vision. So that's why babies can't see very good when they're born. But by 8 months, you have your cone cells. So that's central vision and color vision. And so their visual acuity starts to get better at that point. Oops. Okay. So then the eye is fully formed, is fully mature. We have everything there. So then we just develop visual acuity. So being able to see better and focus better. And so that's the process of accommodation through the ciliary body, and then also the process of interpretation through the visual cortex. So at birth, babies are at 2400. Remember, 20/20 is healthy adult vision. So 2400 at birth, and this is what it means. Okay, what a normal healthy person can see from 400 feet away, a baby has to be within 20 feet to see. Okay, so what a normal person can see from 400 feet away, so really far, a baby has to be within 20 feet to see. So it tells you about kind of how well they can see. And then by 6 months, they're at 2200. Or at 12 months, they're somewhere between 50 and 70, and then by 4 to 5 years, they should be at 20/20. So acquire healthy, what's considered healthy adult vision by 4 to 5 years old. Okay, so that's visual acuity in general. And then you have dynamic visual acuity, which is your ability to see and perceive moving objects. And so this matures from 6 to 20 years of age, and then it starts to decline as early as 25 years old. So if you think about a sport like baseball, professional baseball, they have to be able to detect moving objects such as the balls flying at them, to be able to catch it, to be able to hit it accurately. They're also watching the other players moving around and being able to throw accurately to them, or being able to, like the pitcher, knowing when the runner behind them is about to steal a base. That's peripheral vision acuity of dynamic visual acuity. And so dynamic visual acuity is very important for a pro baseball player, and yet at the age when they're really starting to get into their career, 25, that's when dynamic visual acuity starts to decline. And it may be a slow process, but you still may see some deficits there. So we know that things change with age. We know that movement becomes more difficult with age, but some of that is not necessarily just related to muscle strength or flexibility, or agility. Some of it is related to sensory perceptual changes with age. Also with age, you may have several different diseases that are common. And so glaucoma affects the peripheral vision. And so kind of think about tunnel vision. So you can see what's right in front of you, but the peripheral vision starts to get blurry. Whereas macular degeneration is the opposite. So what's the central vision is not working properly, but the peripheral vision is. So, and then cataracts, everything's blurry. And then retinopathy means that the blood vessels in the eye are bursting and kind of form blood clots. And so that depends, how much is blocked depends on how bad the damage is. So these spots represent places where the vessels have burst in the eye. So all of those make it difficult to see, which adds to the difficulty with movement with age. Another skill besides dynamic visual acuity is depth perception, and that's the ability to detect not only just the depth of an object, but also distance between objects, different sizes of objects over space. And so that's developed as early as 6 months. And they know that they did an experiment where they had a checkered cloth under a clear plastic table, and so for half the table, the cloth is right underneath the table. It looks like a flat surface. And then about halfway across the table, the cloth drops down to the ground. And so with this clear surface over it, it looks like a cliff. It looks like a drop off. So the baby that doesn't necessarily have good enough vision to tell that this clear surface is a table, they see the drop off and recognize it as a cliff, and they'll stop as early as 6 months. And then by 6 years of age, depth perception is pretty well the same as what an adult would be able to do. So this is a question that I want you to think about. Depth perception is a skill that is learned, and it's a skill that's learned through experience. And so you have to be around objects that have different sizes and shapes and different distances from you. You have to observe those objects. And dynamic visual acuity, the same thing. You have to be around moving objects to be able to acquire those skills. So think about this question and decide what the answer is based on what you know about the development of depth perception